Home health is generally even hardly talked about, especially if you're planning on going to pediatric home health. There are definitely some things you must know before you consider for this job. Hi, welcome back to Nursing Unveiled. Here we uncover all the tips and tricks on how to jumpstart a successful nursing career. Okay, so this is the rundown for today's video. First, I'm going to talk about home health and just give you some information to home health first. Then I'm going to talk about what my role as a pediatric home health nurse is, and also give you a glimpse into what are some of the tasks that I would do, and that way it will actually give you a better understanding when I go into the next section, which is pros and cons. And lastly, I'm going to sum this up with what are some of the things you want to know if you are really considering for this job and what you want to ask for employers, etc. So there are two types of home health nurse. The first type is visiting nurse, and the second type is shift nurse. Visiting nurses, they will go from home to home, and what they do would be tasks such as PICC line dressing, IV infusions, or they might do things such as wound care, for example. Also, for home health visiting nurses, they also can admit patient based on their assessment of the patient, whether they are suitable for home health as well. Usually for visiting nurses, they require at least 1 year of RN experience, or maybe at least even 2, depending on which agency you're working for. And the reason for that is because with these types of nurses, they're a lot more independent, and it requires a lot of skill set that they must have within their arsenal in order to carry out their job. The way how pay works with visiting nurses, it really depends on the company that they're working for. Some pay by per visits, some pay by, say, a salary base, and then there are some that pays by hourly. So it really varies, and of course, depending on how much you travel, they also may compensate for mileage as well. And now on to shift nurses, which is what I am. So in shift nurse, what you do is you take care of one patient throughout the entirety of your shift, and you are responsible for their care from beginning to end. Another difference between visiting nurse and shift nurses is that for shift nurse, they're a lot more open to new grads. As I was saying before, I'm a Peds shift nurse, so in my case, I take care of a very high seizure risk client that is dependent on a tracheostomy and also tube feedings. And as you can probably anticipate, some of the tasks I would do for my client is I would have to make sure I suction them frequently to make sure their airways is clear. Also, I'm going to do tracheas to make sure that it prevents any potential infection from developing. And also another thing is, of course, setting up their tube feedings along with nebulizer treatments. Because in this case, as a home health nurse, you don't really get a respiratory therapist coming in every single day, so as the home health nurse, you take on that task of giving them respiratory therapy, such as nebulizer. And my biggest task of all is managing seizure activities. That is probably the one that sucks up majority of my time whenever that takes place. If you want to know more in depth as to what I actually do, make sure you follow me on Instagram page, nursing_unveiled. When that takes place, I have to make sure I monitor my patient, I make sure they are safe, and definitely I would have to contact nursing supervisors and doctors as needed, depending on what the situation is. Other small tasks I would have to take on would be maintain any basic hygiene, such as wiping down surfaces around the area, and also other tasks for pediatrics specifically, which is play therapy, such as storytelling or making sure they do any sensory activities, etc., so that they're engaged. And we cannot forget, these are children, so you're probably going to be attending class with them, either on Zoom platform right now, or you're actually going to be attending together to their classroom. All right, and on to your most anticipated section, the pros and cons. Here it is. So let's start with the pros, and the first one is definitely independence. Now, this one is both a pro and a con, and I'm going to talk about con later on. But for independence, what you want to know is that, of course, in your own setting, there is not much management happening. Nursing supervisors and doctors and whatnot, they're all from a distance. So you definitely work a lot more independently, and that could be a pro in that if you the type works better by yourself, then this is optimal for you. Also, you do not feel like somebody is always watching over you. You also get some freedom as to how you want to run your day, say like in the morning about 7 or 8 o'clock. Usually if you're in a hospital, then you're doing assessment per se, but in this case, you have a little bit of leeway depending on what the day is like for this child. If they have class, then you go to class first. If you have other things you might need to do beforehand, then you can do that as well. So there's definitely a lot more flexibility. However, it's important to note, unlike general home health, this is Peds Home Health. So you have parents around most of the time, and they're going to be overwatching you. So there is some sort of a management there. Unless the parents somehow needs to go to work as well, then yeah, you're going to be by yourself more. Next is that parents are around. Now, this could be both a pro and a con. The reason for that is because for pros, you have an extra pair of ears and eyes and hands to help you out in case of anything. And also they know their child best in these cases because they've been with them for so long, so they know what to look out for, they know what to anticipate. So in that sense, you do not feel so alone that you have to try to figure out everything by yourself. Also, you get the luxury of taking a proper break. Now, with home health, what employers expected is that most likely you may be by yourself and you probably have to look over this patient for the entirety of your shift if you are a shift nurse. And so in this case, with having a parent around, then you get a break somewhere in between a lot better because that's the extra set of eyes, ears, and hands that they're able to provide for you so you can actually have a proper break. Also, having parents around is a con, and I'm going to dive into that later, so definitely do not want to miss that one because I am going to be talking a lot about it as well. Going right along is there is not much work politics or drama. With that said, you can solely just focus on being a nurse rather than having to be caught up in all this drama. In addition, you do not have to worry about any favoritism from management or there is any bias going on. There isn't that work hierarchy that you have to worry yourself over as well. Just overall very drama-free. Next is you don't have to always feel like a middleman or a communicator because as a nurse, especially if you're in a hospital, you're the main communicator between all the different specialties. Now, I'm not saying as a home health nurse you don't need that responsibility, but you just don't need to do that on a daily basis, but rather it is more after like a period of time, then you may have to communicate once in a while. So it's a lot better for your mental health if you feel like you're very stressed out when it comes to having to communicate with everyone. Point number 4 I would make is that it is definitely a lot less stressful because your patient population is a lot more stable and their outcome is a lot more predictable. You know what to anticipate a lot more because you've been with this patient for a lot longer than say if you were to be in a hospital where it's just kind of in and out. And just the fact that I don't have all these alarms going off like 24/7. For example, there will be like a fall risk alarm going off near the nurse's station, and then there's like IV beeping like down the hallway, and then for some reason there's a code out of nowhere, so it's like, where do you want me to be? Point number 5 I want to state is you start to develop a higher understanding of your patient's condition. So to give you an example, I have a patient that has high seizure risk, and he has a huge variety of seizures that I was not aware of at all. Like the most classic seizure that I'm used to is the one that is a tonic-clonic seizure, which is that jerking and contracting type of seizure. So I was not aware there are multiple types of seizures and how they can present very differently. So in this case, for example, even just tonic-clonic seizure, my patient was having this kind of arm-like jerking motion, and at first I thought it was just a muscle spasm, but apparently it's not. For this patient that I have, that is actually his initial signs of having a seizure, a tonic-clonic seizure. So that was something really shocked me because in my head, a tonic-clonic seizure is like a full body, full-on contraction and relaxation type of jerking motions. So why is this a pro? Well, this is a pro because now I know what to anticipate. Knowing that his presentation are like this, I know to start timing him right off the bat and look at how long has been to make sure I give rescue medication necessary. Or in this case, with my client, it's a little bit different. For him, his muscle spasm presents almost the exact same way. So for me, I know what medications to give him. I know to test out either anti-seizure meds or muscle spasm relaxation medications. So so there you go. That is why it's very important as a nurse to know and develop these high understandings. Point number 6 is you start to develop close relationship with the family and the clients. And this is definitely the most enjoyable part of my job because I feel that with that close relationship, you do not feel as if you're much of a nurse anymore, but rather you get to be kind of this, almost this family friend of the family. And in a way, it makes your job a lot more enjoyable in that sense because you don't feel like this kind of disconnect almost when it comes to sometimes with patients. Also, being in a home setting that is so intimate, you start to learn about any traditions and any religion, etc. So you start to know exactly what it's like to learn about diversity. And going right along now is cons. So for number 1, I would definitely say independence as well, because let's face it, with no management or supervisor near you, that could be quite scary, especially if you are new and you do not know what to anticipate, you do not know what to look out for, etc. Then that could be very scary when time comes and you want somebody right there with you. And as I was mentioning before, if you have a parent nearby, then that is kind of your backup in case this situation arises and you need immediate answers. If you're new to Peds Home Health, I really suggest you ask for policies and procedures whenever there's a situation you do not know or it's something that doesn't sit well with you and you just want to get answers. Make sure you ask, because in these situations, because you are by yourself, there is a higher chance of you just making any mistakes, really. So for that reason, you want to make sure you are covered. So making sure you chart all the necessary places, making sure you contact all the people that you need to, just that whole shebang, you want to make sure you actually ask to the fullest detail. Point number 2 is pretty big. That is miscommunication. With how far and wide everybody is, it's bound to happen between teams and also sometimes even between you and family members. Say if they were not clear on certain instructions they have for you for tasks that they want you to do, then that can be easily miscommunicated. So for example, say there was a batch of formula that they want you to toss out because they feel is spoiling perhaps, but they were not clear as to making sure you hold 1 can or 2 cans or whatnot to save for a sample that they want to give back to the manufacturer, for example. Then there you go, there's a miscommunication. That is completely nobody's fault, but at the same time it's just annoying to deal with because now you kind of feel like you're in a position where you take responsibility. Point number 3 I want to make is when parents are around, they can be protective, and especially if they're overprotective, then that is going to be very tough for you to get through your shift, because they can start scrutinizing every little thing that you do and overwatching you, and that's almost worse than management sometimes. Alright, new setting, guys. My house is actually going to be doing some construction this morning, so I'm going to be here in this setting. Okay, on to point 4. It could be very hard to convince parents to trust you or just trust your suggestion, because let's face it, parents has been with their child for such a long time. They think they know what's best for their child, and therefore if you ever have any suggestion, it will take them some time, or at least it will take a lot of convincing in order to get them to try to work around what you are trying to say to them. And that leads me to point number 5 is sometimes they may not view you as a professional after a while, and this is mainly because you guys have been together for such a long time. This is especially true when it comes to shift nursing, because you're always in their family setting, so they see you more as a caregiver versus more of a professional. So it takes a little bit of reminding sometimes, or at least it takes a little bit of boundary setting. And just to be honest, parents can actually take it even so far as to belittle a nurse, so just have that in the back of your head, and that is not always the nicest. And on to point number 6. This is very important, and I think this is the highlight between the difference of home health versus hospitals, and that is resources are limited. Just to start off, unlike a hospital setting, in home health, there's not all that monitors, there isn't all those supplies, so you can't just grab it whenever you want to. There is a limit to all these resources that you have. And it could be quite stressful and frustrating, especially if you find yourself in an urgent condition, because it can become stressful very quickly if you do not have the proper equipment. So you start to have to learn how to adapt, and you actually use your assessment skills a lot more to try to figure out what might be these vital signs for your patients. So to give you a very good example, say if your patient started to have nasal flaring and you started seeing them to have labor breathing, then that is a potential sign that your patient's O2 saturation is dropping and they probably need some support in oxygen. Also, with limited resources, that means you have to start tracking and keeping tabs on how much supplies you have so that you can order it before you actually run out. And with that said, you want to take into consideration shipment time, because sometimes if somehow your mail got screwed up for whatever reason, then that is also time that needs to be taken into account for. So this was definitely a huge change for me, because I was used to a really well-funded private hospital before being a home health nurse. And if you have any questions, or if you're curious as to what my background is, I had a video that is on things I wish I knew to know before becoming a CNA, and I will link it up and also in the description box down below. In that video, I talked about my experience of being a float pool CNA for 3.5 years, and also some of the tips you might need if you are ever curious about how to cluster your care, etc. So going back to shipment and supplies, what I need to account for nowadays is an extra storage, where in case if shipment gets screwed up, then that's it for supplies. So I have to make sure I store an extra baggage away in case of anything that goes wrong. Because if you do not do any extra storage, then most likely you probably find yourself in a setting where you have to reuse supplies, and that could be dangerous, especially when it comes to tube feeding supplies. Those can only last 24 hours. Besides just patient supplies, you yourself might have a limited resource to supplies depending on the company and the agency that you're working for. So a good tip is actually have your own bag and actually have your own gloves, hand sanitizer, and maybe even some gauze and scissors, just in case if there is a limit in which you actually run out any of these supplies, you have it on hand. On to point number 7 is family setting. Family setting is actually quite important. So let me explain what this means. Say if you're in a household that is clean and tidy, or that they're more affluent, then your resources and what you have access to is a lot easier. But say if you're in a neighborhood that's a little bit more run down, then sometimes this can be quite stressful, because not only do you have to worry about your own safety, but at the same time, the family setting might be very tough for you as a healthcare provider to try to communicate between family members and child, depending on what the dynamic of this family setting is. And point number 8, this is not a full-on con of the job, but just something to have to consider is you're working with children, so most of the time you have to be on very high energy level to get them to engage. So with that said, you yourself can be very drained out from that, especially if you have your days where you're just feeling super tired, but ultimately you're still with the child, so you have to engage with them, and therefore you have to try to do everything you could to get them to listen to you. Not going to lie, some days I just have a resting face, but however, when I'm in there, I have to really put on a smile, and that is tough when you're forcing it to that extent. And at the same time, just to know, the whole point of this is that kids are very exhausting. All right, so that was all the cons. Now I just have some quick facts that I want to throw out there that you may want to consider. So for example, what you want to consider is that these are children, so they still have education. And most of the time, what it's going to happen is that as the nurse, for shift nurse especially, you're going to be accompanying this child into their school. So that could be something that makes you feel really a part of this child's life. In addition, other things you may have to accompany this child is to a doctor's appointment, maybe OT, or even speech therapy. Just anything that helps the child to progress, you're most likely going to be a part of that. Another fun fact is you're probably going to become a pro at nursery rhymes. So before I started this job, usually I just hum or I just know the chorus lines to a nursery rhyme. Nowadays, I feel like I almost know the entire lyrics of these nursery rhymes. It's a little ridiculous. All right, moving on. If you are truly interested in becoming a Peds Home Health nurse, there are definitely questions that you have to ask your employers. So the first one is, where are they getting their patient populations from? So what type of facility are they coming in from, and what is the acuity level that you're working with? So them to give you some example as far as what you might see for patient. Is there going to be tracheostomy? Is there going to be tube feedings? Do they need IVs, etc. Also, it's very important that you ask the employer whether this is a contract job or can you leave at will, especially if you're a new grad considering for a job like this and as more of a transitional type of job, then that is something you must ask, so you know what are the time frame that you can potentially stay and leave if you need to. Also, you have to ask them if there is any hotline numbers. This is big because if management does not do a good job and you're in a situation where it can turn south anytime, you want to make sure you have the proper hotline numbers to call right away so you can get your answers right away, or else it's going to be on you. Also, you want to check and see how they monitor the whole entire system. So a question to ask is, if I were a shift nurse, how often would a nursing supervisor come to visit? Is it going to be 3 months? Is it going to be 6 months, etc.? So this way you can tell if they're monitoring whether the employees is getting mistreated or if the family is getting mistreated. This way it gives you a good guideline as to whether management is actually good or not, because you want to make sure that they are checking up to see whether their employees are doing okay or the family is doing okay. So this is one way to gauge that. Remember how I was talking about resources are limited? This is also a question you're going to be asking as far as how are you going to be provided with the equipment. Is it going to be a bag that they give you, or do you have to actually provide some of these equipments yourself, such as maybe, I don't know, like gloves, hand sanitizers, face masks, stuff like that? And also, are they restocking it regularly, or do you actually have to call in whenever you see that there is a low number, and then you're going to call in and get them to restock? Another question you can ask your potential employer is, say if a family goes on vacation, in that case, what happens to employee? Are they going to be assigned to a different job, or are they going to be compensated compensated in any way. Now, let's say you did end up with the offer and you're really considering this job now. So what you need to ask now is how many days are vacation time for employees? Because some places I know, they only consider 4 days. So Christmas, New Year's, Easter Sunday, and it was, Thanksgiving. But overall, you do learn a lot in Peds Home Health in terms of being independent, adaptable, and to really think on your feet. And more importantly, because it is Peds, you actually handle the child's care and the family care almost equally. A note for new grads, if you are truly considering for this job, I think it's worth it to take it on. This is because I think you do have a much more smoother transition into the nursing skills. So tube feeding, tracheostomy, maybe even wound dressing changes, etc. So this way you do have a much more smoother transition into the skill sets versus say if you were to just go straight into a new grad program, which is great. It's a great opportunity, but definitely you feel a lot more like you just got thrown into a fire. If you like this video, please give it a thumbs up, subscribe, and also hit the notification bell. I have new videos every Monday, so stay tuned. Bye.